House of Delegates adopted our resolution today. It was about improving awareness about the improper disinfection of stethoscopes by nurses and physicians. Justin and I really wanted to work on improving the awareness of this because we oftentimes see nurses and oftentimes student nurses, techs, and other physicians and other staff members in the hospital, such as respiratory therapists, and they'll go back and forth from patient to patient room, oftentimes especially isolation patient rooms. And unlike the other equipment such as Dynamaps and IV site kits and everything else that we do clean, we don't clean our stethoscopes. And studies have shown that between 5 and 17% of our stethoscopes are contaminated with MRSA. So we have printed this resolution for it to be published to all these professional nursing organizations to improve the awareness that simply by swabbing your stethoscope with a 70% alcohol swab, just like we do to clean other hospital equipment, you can decrease the amount of MRSA and other pathogenic bacteria on your stethoscope by up to 100%.
And I'm Justin Alexander from Arkansas State University, Jonesboro, Arkansas. Imagine you are a new nurse working on a med-surg floor and you're in charge of 6 patients. As you reflect at the end of the day on the mistakes you made and the things you did right, the following questions roll through your head. Did I wash my hands between each patient? Did I scrub the hub for 30 seconds? Did I maintain sterile technique during that dressing change? However, I would bet that the question, did I clean my stethoscope between each patient use, never crosses your mind. With the rise of infection control practices across the history of nursing and our lifetime, we have neglected to place specific guidelines for stethoscope disinfection. Studies have shown that significant proportions of stethoscopes harbor pathogenic bacteria, including MRSA. It should also be noted that only a small percentage of physicians and nurses alike disinfect their stethoscope on a regular basis. Disinfecting your stethoscope between each patient use is a guideline that must be implemented worldwide. In a study to improve disinfection rates of stethoscopes at a Boston Children's Hospital, it cost them roughly $17 per room to increase the stethoscope disinfection rate from 13% to 67% among nurses. This cost is minuscule in comparison to treating a hospital-acquired infection. In alignment with the nursing values and ethics of beneficence and non-malfeasance, we as future nurses must stand behind this issue. This resolution reaffirms a previous resolution passed by the NSNA in 2010 entitled In Support of Cleaning Stethoscopes Between Patients. 6 years have passed and this issue has not reached a resolution. Therefore, I'm asking you to join me in passing this reaffirmation so that appropriate actions and policies can be enacted to allow a safer environment for our patients. Thank you for your time and attention.